Thank you very much, and it's a real pleasure and honour to be here. And I think a tremendous thing to have organised and to be putting on, and because I know how difficult it can be to access services and information in rural areas. I'm going to speak about some of the things that are often left out of the mix of cancer management, and really following on from what Robert said, really we're finding very interesting and very important parts of the total picture. A lot of it is to do with self-help, and I think that very often we're good at offering all the things that we can offer to patients as healthcare practitioners, but mobilising somebody's own ability to help themselves and to know what sorts of nutrition and exercise and other things that we can do is something that we often leave out, and that's what I'll be focusing on. Some of you might be aware that the Senate had an inquiry into the management of cancer and reported 32 recommendations based on that, and said that there's a lot of information that cancer patients need to have more access to, and carers as well, and that includes areas of self-help, support programs, complementary therapies, lifestyle management and so on. And I think that there'll be a fair amount of content on the slides I'll be showing today, but there is going to be a DVD available through the various organisations that are associated with today, and you can go back and access the information and references if you would like to. When we're looking at cancer, we know as healthcare practitioners how difficult it can be to manage. And sometimes we don't always have the successes that we want, despite our best efforts and the best efforts of the healthcare team. And we don't always have the expected or anticipated major impact. Recent review, for example, for most of the major cancers, chemotherapy doesn't have as much effect in long-term survival as we might hope. But that doesn't mean that there isn't a lot that can be done, and a lot for quality of life, but also a lot that we can do for ourselves. When we talk about integrative medicine, that is, we're talking about an integrated approach. I'm concerned when people think, excuse me, it's an either-or approach. I'm going to do the medical things or I'm going to do something else. So it's not an either-or approach. We're looking at the best of conventional medical care, the best of cancer management, but also the lifestyle interventions. A holistic approach includes the physical, mental, emotional, spiritual, social and environmental issues, and also the best of complementary therapies, which ones are evidence-based and which ones can be useful for us. So exercise, diet, supplements, social support, stress management, meditation, and I'll also be speaking about a few things related to complementary medicine. So lifestyle I think we can be pretty confident about, and evidence-based complementary therapies, we need to have a look at some of these areas as well. I'm not going to go into it in great detail, but Robert's been given a great overview about physical exercise and cancer. These are 3 studies, for example, just from the last year. Women with breast cancer halving the death and recurrence rate if they exercise moderately as described. Men with prostate cancer, a third the risk of having advanced prostate cancer compared to less advanced cancer if they exercise regularly. People with colorectal cancer, about a halving of death rate for those with stage 2 and 3 cancer. Exercise is really something that needs to be a part of standard care, working in a graded sort of way. You can see on the graph that the more you do, the greater the benefit. Obviously, you don't want to exercise to traumatise the body, you exercise to really get it moving. So that has to be, I think, a part of standard management. We're going to talk a little bit about nutrition and the role of nutrition. This is a study, and it was looking at women with breast cancer, and they were following a marker of how much fruit and vegetables they ate. And if they ate regular high amounts of fruits and vegetables, they had about a 43% reduced chance of recurrence of their breast cancer. Now that's a very promising finding. Obviously, there's been lots of other research showing lower incidence of various cancers, but increasing the amounts of fruits and vegetables with all the antioxidants and vitamins and everything else, trace elements that are a part of that, is a really important part of the picture. Diet is often left out of the conversation. It needs to be in the conversation, and it needs to be more than just eating a sort of a healthy diet. It's not like, you could never have those things that you really enjoy, but it's just that the balance between those things that the body really needs and the things that sometimes are not so good for us, maybe that balance needs to shift. Now, there's a lot of questions about antioxidants and supplements and so on, and there may be a role for some carefully selected and evidence-based antioxidants, and this is a conversation you need to have with a trained healthcare practitioner. But it seems pretty clear that getting the antioxidants through the diet is the most effective way to get benefit from them, more than taking the supplements. That is, not having a healthy, nutritious diet and thinking that it's going to be replaced by supplements is not perhaps the right picture to have. So it's really, I think, the diet that needs to be put in place first. People talk about things like green tea, and that's got lots of antioxidants and other things in it. And we know, or there's increasing evidence of reduced rates of various cancers, including gynecological cancers. More research needed there, but now being used as an adjunct for women who are having treatment for breast cancer. And green tea is an adjunct to that and showing better results than just having the chemo by itself. And so, again, there may be something that's promising there. And but when we look at people who make efforts to improve their lifestyle, and this is something where we really need help to do that, because it's not easy to do it by ourselves. So the help of a support group, for example, a team approach, where cancer patients make consistent steps to improve their lifestyle, it's consistently involved with better quality of life. Now, it is interesting, and it's unfortunate, the relative lack of research, and this is something that the Senate said that we need to get more involved in, but the relative lack of research of total lifestyle programs and what are the outcomes for cancer patients, not just in terms of quality of life, but in terms of cancer survival. This is the first really quality trial that I know of. It was done by Dean Ornish, who originally did his research on heart disease. He took 80 men with early prostate cancer who chose to watch and wait. And for early prostate cancer, that is not an entirely unreasonable thing to see if it progresses and one needs to have aggressive treatment, or is it one of those very dormant, slow-growing cancers that may never be a problem for the person? So this was 80 men who said, I don't want to launch into aggressive treatments, I want to watch and wait. Half of them got a lifestyle program, the other half didn't. The lifestyle program was a vegan diet with lots of fruits and vegetables. There's that soy and the tofu and so on, which has got quite a lot of phytoestrogens and other things in it. Fish oil and the omega-3 fatty acids. Some carefully chosen supplements, vitamin E, selenium and vitamin C that they included as well. Regular exercise, stress management, including some gentle yoga, meditation, breathing exercises, and in a support group. They met on a weekly basis in a support group. Now, it significantly improved the mental health and quality of life of the people who went through the program. But what they also found was that the men in the lifestyle group had PSAs that were coming back down again. That is, they weren't receiving at this time any medical treatment, but the PSAs were coming back down, as well as other cancer markers improving. No men in the group that had the lifestyle program went on to have aggressive cancer in their 12-month follow-up, and they'll be following them up further in coming years. In the 40 men who didn't have the lifestyle program, 6 out of 40 had gone on to have aggressive cancer, and the average PSAs and other cancer markers were going up. These graphs here just show you that the more change, the more the people put into their lifestyle, the greater the benefit. If they went through the program and really didn't live it in their day-to-day life, didn't show any benefit, it was as if they never went through the program. So the more that people put in, the more that people seem to get out. I think this is a wonderful model for adjuncts to add to cancer care, that it should be a part of standard cancer care offered to all cancer patients to take up if they feel so motivated. So let's talk a little bit about stress now and the role of the mind, which is very important as well. Just in case you thought your situation was precarious, consider it could be a lot more precarious as well. Now, mental health and effects on cancer obviously affects quality of life, but also there are issues related to whether or not we're more at risk of getting cancer or cancer progression. There have been a series of studies showing that chronic depression is associated with about a 50% increased cancer risk, and with other conditions as well. The physiology of depression and high levels of anxiety are not a good chemical mix, if you like, for the body. Stress and cancer. Stress is a hard-to-define term. This is a hard-to-research area, certainly very challenging. Some studies show a link with stressful life events and cancer. Some studies don't. The studies that more consistently show a link are the ones that look more at the individual experiencing those life events rather than just looking at people overall. That is, we experience stressful life events differently. For one person, an event happening is a major stressor. For somebody else, the same event is the source of amusement. So, for example, no Victorian football teams making it to the preliminary final is a source of amusement for most of Australia, whereas for those living south of the Murray River, it's a traumatic experience. Our perception of life events has a big effect on our physiology and experiencing them. Now, Plato said, "You ought not to attempt to cure the body without the soul, for this is the great error of our day in the treatment of the human body, that physicians separate the soul from the body." Plato's talking about the soul or the psyche, mental and emotional world of the person. Now, if we treat the soul as well as the body, that is, the mental and emotional support, does this improve quality of life and survival? Big questions. Not all support groups seem to do that. Some do, and some don't. And so not all support groups are the same. In fact, some patients often find that going to the support group they're going to makes them often feel worse. So they're not all the same. This first study by David Spiegel was on women with advanced breast cancer. It was obviously an effective support program that significantly improved mental health and quality of life. Now, what they found was, at the end of 10 years, they found a doubling of average survival time. And these were women with advanced breast cancer. So they scratched their heads because they didn't expect to find that finding that they published in The Lancet. Now, if you look at, there have been about 10 studies that have been reported on this. Do support programs improve survival or not? Now, there's no evidence to suggest that going to a support program that does not improve mental health and emotional well-being, that it improves survival. There isn't evidence to support that. But there is evidence to support that if you go to a program which significantly improves mental health, coping, quality of life, then it seems to improve survival. That is, ineffective support programs don't seem to help, but effective ones do. What's an effective support program? I think that obviously the patient and the carers are the best judges of that. If you feel that it's helping you to cope, improve your emotional health, feeling more at peace with yourself, better able to communicate effectively and so on, then that's probably the best judge. But 8 out of 10 studies have followed that rule, if you like. I'm not going to go into the biology of this and what happens in our physiology and all the chemicals when we're stressed or depressed or feeling highly anxious, but certainly peace of mind, feeling that we express emotions well, certainly has some beneficial physiological effects in the body. You hear a little bit about chemicals like melatonin. It's a hormone made by our own body, and it has a whole range of effects. You'll see on the right-hand side of the screen a whole range of effects that seem to be positive for cancer. And if you look at the things that enhance our body's ability to make melatonin, you find things like meditation, sunlight, subdued lighting after sunset, calorie restriction, which is not having a diet full of excess calories, too many fats and sugars and so on, moderate physical exercise and so on. So basically we're coming back to lifestyle things that seem to enhance that. Meditation, something I practice twice a day and I certainly highly recommend to others. If you meditate regularly, you probably start to look like this, which may be very attractive for some and not so attractive for others, the thought of that. So meditation-based therapies and mindfulness-based therapies it's a form of meditation, are being increasingly researched, and in the studies have been found to be helpful for stress, anxiety, depression, eating disorders, etc. And a number of things too related to immunity, pain management and so on, again very beneficial for those things. So in terms of symptom control and coping, there's a lot of reasons that we really should think about practicing meditation. Now, in terms of meditation and survival, mostly meditation's been a part of the support programs that have been found to be effective, but not looked at by itself. So it'd be very hard at the moment to say there's any more than circumstantial data to suggest that meditation by itself improves survival. Those sort of studies haven't been done, but we know that it certainly has been a part of the mix in those effective programs that I was mentioning before. So we teach our medical students at Monash about the essence of well-being and in particular the essence of cancer care. It requires education, getting good quality information, stress management, mental and emotional health, spirituality, where we find meaning, purpose, direction in our day-to-day life, the importance of exercise and healthy nutrition, connectedness or social support, where we get that from and the quality of it, and environment, a healthy environment, and these are elements which I think should be the part of management of any chronic condition. So let's have a little bit of a talk just for a few minutes about complementary therapies, and we'll have a look at some of the kinds of things that, or some of the kinds of issues. I'm not going to advocate any particular treatment. I'm going to use things just more by way of examples to illustrate important principles that might be important for any particular cancer. Why do we need to know about it? And this is certainly for us healthcare practitioners, because people are certainly using a range of complementary therapies. And often doctors and patients aren't talking about this, and we need to have open lines of communication. There are concerns sometimes if somebody's using something that they'll think, oh, I'll just go off my medical treatments, or I won't have my the medical treatments that are clearly could be beneficial for the person when they can be offered. So there are concerns certainly about that. There's also, and especially when a treatment is highly, highly expensive, there's certainly, the more expensive, the more my antennae go up in terms of the potential for monetary exploitation. But there's also the aspect that some complementary therapies may offer potential new treatments, and obviously we need to be, as healthcare practitioners, up to date with the evidence. We can't just say, oh, there's no evidence, and just as a pat line. We really actually need to be aware, and we need to help people to make safe and informed choices. These are just some figures. Most cancer patients will use one or other form of complementary therapy, and most will not tell their doctors about it. They do not have a conversation with their doctors about it. These lines of communication need to be open, and doctors need to listen respectfully to patients' questions and concerns in this area. Most popular treatments: meditation, change in diet, multivitamins, but there's a whole range of things that people are using. This was the Tasmanian Premier. He got 143 offers when he got lung cancer on various forms of complementary therapy. Some were clearly not evidence-based, some hadn't been researched, and some were clearly beneficial. So we're obviously bombarded with a lot of well-meaning advice very often, but it can be of variable quality. So if you take some things that I often get asked about: shark cartilage, mistletoe, I should be asked soon about pomegranate juice. Shark cartilage. You take something like shark cartilage, and there was some early evidence to suggest it could possibly have a role, some circumstantial evidence could have a role in cancer. So far, the data on outcomes for cancer patients haven't supported it as having a strong effect. Mistletoe, there is some data, early data, to suggest it might be helpful as an adjunct to cancer treatments. Pomegranate juice, there's a study recently on slowing the growth of prostate cancer, and survival may well be improved with that, and it tastes good as well, having tasted pomegranate juice. So there are some things that at least are very safe, some things that might provide some benefits, but we need to be realistic about whether or not there is really good evidence to support all of them. I'm not going to go into the details, but if you get the DVD, you can get the references on those. I think you should be more explicit here in step 2. There's a lot we don't understand about a lot of the way complementary therapies work, and so there's circumstantial evidence. It could have a role. Provisional evidence seems to have some early effects. Definitive evidence in terms of survival for most complementary therapies, there's not a lot of evidence yet. We need more research. So do things provide a theoretical benefit or a proven benefit? Do we know the mechanisms or not? Does it improve survival, or does it have a role for cancer in managing symptoms? Is it safe and low cost, or unsafe and high cost? And we need to be very cautious about those. Are the side effects beneficial or harmful? And many complementary approaches, meditation, good exercise, etc., have beneficial side effects. But for symptom control, the evidence is getting very clear these things can have a very beneficial role. For women with breast cancer, acupuncture for nausea, relaxation for stress reduction, anxiety, pain management, and so on. If somebody's got pain, there's a whole range of different treatments that have got some evidence to support them. Or for shortness of breath, again, a range of different treatments can be offered. You need to speak to somebody trained in these areas to find out what might be helpful for you. For depression, again, a review, many different things that can be used, and again, to look into the use of some of those. So what do you need from your doctor? Just a few remarks in closing. You need someone who can help you to make informed and safe choices, someone who knows how to support healthy lifestyle change, someone who has the ability to engage respectfully in a conversation about complementary therapies as well, or at least has a basic knowledge in them, or at least can help you to find quality sources of information. You need somebody, I think, who has an integrated approach to offering you the best of everything that's available for cancer management. And if your doctor's not helpful in these areas, well, I think you might need to have another conversation with another healthcare practitioner who can, and the original doctor can still help you with what they're expert in. These are some of the programs that we teach medical students at Monash and so on, in mindfulness-based stress management and the like, if you're interested. So there are a lot of different treatments you can use, a lot of things that might be potential, and you don't have to necessarily do things the way they've always been done. In fact, in cancer management, things could be very different 5 or 10 years from now. And self-help, I think, is going to be a very important part of the mix. So thank you very much.
Thank you very much, Craig. That was fascinating. It's about, I think, 5 or 6 years ago, we introduced a yoga program here at Westmead for our patients with breast cancer. It happens twice a week, and it's our most popular program. And it was good to see, I think, 2 or 3 months ago, in one of the journals saying that yoga improves survival for women with breast cancer. So I think these programs are very, very important. And again, as a busy clinician, often with a full waiting room, you often don't have the time to delve into all of this, but it's really important to talk to general practitioners, breast care nurses or cancer nurses, and of course your doctor or other doctors who have expertise in the area, such as Craig, or read one of his books. I think I'll be going out to get one of those books this afternoon. The questions, 1800 062 277 is the telephone number. Please call that number and fax to 02 9845 7117. Our next speaker is Mr. Graham Goodings. It's, you know, as a clinician, we interact with our patients briefly. It might be an email, a telephone call, a consultation. It's when you have to suffer the disease and live with it 24 hours a day and live with the thought, or as some of my patients say, the monkey on my back after treatment. It's I think that's where the real challenge is. And I'm very pleased today that the organisers have put Graham on the program. Graham is in fact a journalist, and he's currently the news anchor at Channel 7 in South Australia. He's also a radio announcer, as you'll see very soon by his deep voice. After a busy life in media in 3 states, Graham was diagnosed with cancer in 2004. He's here with us today to relate his story and experiences. And Graham's topic today is, of course, a personal journey, and he'll share this personal journey with us today. Thank you very much, Graham.